Down through the ages, men have used a fascinating variety of techniques for resuscitation of the dead and near dead. In the 16th century, fireside bellows were used to force air into the lungs. Later, the barrel method became accepted practice. Beginning this century, the prone pressure method was widely used. Today, the search continues for a better basic life support system, an emergency first aid procedure for saving lives, for preventing death from cardiac arrest, heart stoppage, or breathing failure. Many lives can be saved each year if enough individuals are properly trained in heart-lung resuscitation. The immediate application of CPR, cardiopulmonary resuscitation, is capable of preventing death and can be applied anywhere without the use of equipment by trained individuals. CPR is an emergency first aid procedure that combines artificial respiration and artificial circulation when both breathing and pulse are absent. Mouth-to-mouth breathing is the best rescue technique for artificial respiration, and external chest compression is the best rescue technique for artificial circulation. External chest compression is only effective when used with mouth-to-mouth breathing. In all resuscitations, the emergency medical system should be activated after a breath and pulse check has been made. If you are not alone, send someone to telephone for help.
Quick, call for help. Right.
Activate the emergency medical system by dialing 911 or your local emergency number.
Medic command. Yes, sir.
By phoning after the breath and pulse check, useful information can be given to the dispatcher so he can send the appropriate personnel and equipment.
Okay, we'll have a unit on the way.
The most important information is a complete address and exact location of the victim.
Medic 4 from Medic Command.
Okay, Medic 4.
Yes, we have a detail for you. 3412, Federal, possible heart attack.
3412 Federal, about 8.
If you are alone, CPR may be performed for 1 minute, then quickly telephone for help. Immediately return to the victim and resume CPR until help arrives. Time is an all-important factor in giving CPR. If the rescuer does not act quickly, within seconds, the victim may suffer permanent brain damage from lack of oxygen. And if the heart has been stopped for more than 6 minutes, the central nervous system may be irreparably damaged. Effective resuscitation can only be accomplished with unobstructed air passages. In an unconscious person, relaxation of the jaw allows the tongue to drop backward in the throat, resulting in blockage of the air passages. To open the air passage in the unconscious patient, tilt the victim's head back by pressure on the forehead with one hand, and with the other hand lift the neck. This maneuver extends the neck and lifts the tongue away from the back of the throat, usually opening the air passages and allowing the victim to resume spontaneous breathing. An alternate method for opening the airway is the chin lift technique. It may be particularly effective on some persons where the neck lift method is not successful. Here, the tips of the fingers of one hand are placed under the lower jaw near the chin, and the chin is lifted upward. At the same time, the other hand presses on the victim's forehead to tilt the head back. Care must be taken not to put undue pressure on the soft tissues under the chin, for this might obstruct the airway. Also, the mouth must not be allowed to close completely. If necessary, the thumb can be used to depress slightly the lower lip to help keep the mouth open. Regardless of what method of opening the airway is used, the head must remain tilted at all times during resuscitation, even for unconscious victims breathing on their own. Now you must check for the presence or absence of breathing while maintaining the open airway position. Look toward the victim's chest and stomach. Watch for the chest to rise and fall and listen for air escaping during exhalation. Also, feel for the flow of air on your cheek. If the victim is not breathing, the next step is to inflate the lungs. To do this, keep the head tilted back and pinch the nostrils closed with your thumb and index finger of the hand that is on the forehead. This is to prevent air leakage. Take a deep breath. Open your mouth widely and place it over the victim's mouth, making a leak-proof seal. Blow 4 rapid breaths into the victim's mouth without waiting for complete exhalation. Check for exhaled air and fall of the chest after the 4th breath. Now, check to see if the heart is beating by feeling for the pulse in the neck. Hold the head backward with your hand on the forehead. Using the index and middle fingers of your other hand, feel the voice box in the middle of the neck. Slide your fingers to the side toward you and press gently into the groove between the windpipe and neck muscles where the artery is located. Press gently with fingers remaining flat over the side of the neck. Spend 5 to 10 seconds feeling for the pulse. If a pulse is present, continue 1 lung inflation every 5 seconds or 12 times per minute. If you cannot feel a pulse, start external chest compressions at once. Make sure the victim is resting horizontally on a firm surface. Next, locate the lower half of the sternum or breastbone. In order to be effective and to avoid injury to the victim, pressure must be applied at a point in the center and on the lower half of the sternum or breastbone. One method of locating the correct pressure point on the sternum is to feel the lower margin of the victim's rib cage and then run your fingers along the ridge line to the notch where the ribs meet the sternum. Now, with the middle finger on the notch, the index finger is placed next to it on the lower end of the sternum. The heel of the other hand is placed next to this finger on the long axis of the breastbone. The first hand is then removed from the notch and placed on top of the hand on the sternum. Both hands are parallel with the fingers directed away from you. Your fingers may be either extended or interlaced, but they must be kept up off the chest. Another method for determining the correct pressure point on the sternum is to first locate the xiphoid, the bony tip at the lower end of the breastbone. Place your ring finger on this bony tip and place your middle and index fingers just above this point. Now, place the heel of your other hand adjacent to your fingers. The heel of this hand is now on the lower half of the breastbone and at the correct pressure point for applying external chest compressions. The heel of your other hand is now placed on top of the first hand with the fingers held off the chest. Keeping your arms straight with the shoulders over the hands, rock forward using the weight of your body to exert pressure vertically or straight downward. The breastbone should yield 1.5 to 2 inches. Press on the breastbone rhythmically and smoothly, slightly faster than once every second or about 80 times per minute. The downward movement either compresses the heart between the breastbone and the spinal column or raises the pressure inside the chest. This compression propels blood out of the heart into the lungs and body. When the pressure is released, the chest re-expands and the heart refills with blood. Each compression produces a pulse and must be regular, smooth, and uninterrupted. External chest compression alone does not produce ventilation of the lungs and therefore must be accompanied by artificial ventilation. When there is only one rescuer, and after the initial 4 ventilations, 15 chest compressions at a rate of about 80 per minute should be alternated with 2 mouth-to-mouth inflations. This consists of 2 very quick lung inflations after each 15 heart compressions. The 2 inflations must be delivered in rapid succession within a period of 5 seconds without allowing full exhalation between the breaths. Because of this brief 5-second interruption, the single rescuer must perform each series of 15 chest compressions at the rate of 80 per minute, slightly faster than 1 per second, in order to achieve the recommended 60 compressions in 1 minute. Compressions should be interrupted briefly, about 5 seconds after the first minute of CPR, to check for return of a spontaneous pulse, heartbeat, or breathing. This should be checked every few minutes thereafter. Continue CPR, 15 chest compressions, alternated with 2 mouth-to-mouth inflations, until the victim recovers or until professional medical help arrives. Help should be summoned as soon as possible by activating the emergency medical system by phoning 911 or your local emergency number. If the victim must be moved, CPR needs to be continued uninterrupted during transportation. Remember, the basic principles of cardiopulmonary resuscitation are: first, position the victim and check for responsiveness by shaking gently.
Are you okay? Are you all right?
If there is no response, call out for help.
Help!
Make sure the head is tilted back as far as possible to open the air passages and then check for breathing. If no breathing is present, inflate the lungs with 4 quick breaths, making sure that your lips form a tight seal to prevent air leakage. Then check for a pulse for 5 to 10 seconds. Send for help. If no pulse is present, begin external chest compressions, making sure the heel of your hand is placed correctly over the lower half of the sternum and that you push the sternum straight downward 1.5 to 2 inches at a rate slightly faster than once every second if working alone. Since artificial ventilation is always necessary when artificial circulation is required, it is preferable to have 2 rescuers perform CPR. The second rescuer should identify himself as a qualified rescuer.
I know CPR. Do you need some help?
Yes.
Without stopping, the first rescuer continues chest compressions at the 80 per minute rate. The second rescuer checks the victim's carotid pulse. A pulse should be felt if the compressions are being performed adequately.
11 and 12
Stop
and
compressions.
13.
When a pulse is felt, CPR is stopped for 5 seconds to check if the victim has a spontaneous pulse and is breathing.
CPR.
If there is still no pulse or breathing, the second rescuer should immediately deliver a full, deep breath to the victim. The first rescuer then continues the compressions, but at the 2-person rate of 60 compressions per minute. The second rescuer remains at the victim's head, keeping it tilted back, and continues rescue breathing, interposing a breath during the upstroke of each 5th chest compression, as if trying to lift the compressor's hands with his ventilation. This alternate series of 5 chest compressions, followed by 1 lung inflation, provides adequate blood flow and oxygenation to the brain and other vital organs. The rescuers can switch positions when necessary without serious interruption. The chest compressor, instead of starting a cycle with 1,000, says change 1,000. The change is made after the 5th compression. After giving a breath, the other rescuer moves into position to give compressions. The compressor completes the 5th compression in the sequence, then moves to check the pulse for no longer than 5 seconds.
Continue CPR.
1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000.
CPR should be continued until either the victim is revived or a physician or other responsible person assumes responsibility and continues basic life support or emergency medical services.
4, 1,000, 5, 1,000. Change 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. No pulse, continue CPR.
1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000.
CPR for infants and children follows the same basic principles as for adults. The main differences lie in the techniques that allow for variation in the size of the smaller victim. Gently tap or shake the infant to establish unresponsiveness or respiratory difficulty.
No.
He may only need his airway opened in order to resume normal breathing. If the infant is found face down, he must be rolled over by turning his whole body as a unit. Use one hand to support the head and neck so they don't roll or twist. The infant victim must be carefully positioned, and the shoulders and back should be supported with a folded blanket, other firm material, or the other hand. Once it is determined that the victim is unconscious, the airway must be opened. This is best done by the head tilt neck lift technique. One hand is placed on the forehead, the other hand or fingers under the neck. lift the neck slightly while pushing back gently on the forehead. Too much head tilt can obstruct the airway. In some situations, the head tilt chin lift technique can be helpful in moving the tongue forward and clearing the airway. In this technique, pressure on the forehead maintains extension of the head, while the fingertips of the other hand firmly but gently lift the bony part of the jaw, while being careful not to cause pressure on the soft tissue under the jaw. While maintaining an open airway, check whether the victim is breathing by placing your ear over his mouth and nose to feel or hear any air escaping, and look to see if his chest or abdomen rises or falls. If the infant is not breathing, cover his mouth and nose with your mouth, making a tight seal, and give 4 gentle breaths in rapid succession. Blowing pressure should be just enough to cause the chest to rise. Improper opening of the airway may result in filling the stomach with air. Next, it must be determined if there is a pulse. It is recommended that the brachial pulse be checked. This pulse is located on the inside of the upper arm, midway between the elbow and shoulder, with the arm in this position. With your thumb on the outside of the infant's arm and the tips of your index and middle fingers on the opposite side, press lightly toward the bone. If a pulse is not evident, external chest compression should be started immediately. The next step is to locate the pressure point for external chest compressions. Since an infant's heart is situated higher in the chest than an adult, the proper area of compression is the mid-sternum. Draw an imaginary line between the nipples and locate a point at the mid-portion of this line. This is the proper area of compression. With your fingers on the mid-sternum, compress the breastbone 1/2 to 1 inch. 2 or 3 fingers are adequate for applying proper chest compressions on an infant. Because an infant's heart rate is faster, the compression rate must also be faster, approximately 100 compressions per minute. Rescue breathing must always accompany external chest compressions, and the two must be coordinated. After each 5th compression, 1 breath is given. This ratio of 5 compressions to 1 respiration is continued throughout the CPR procedure and remains the same whether there is 1 or 2 rescuers. For children between the approximate ages of 1 and 8 years old, external chest compressions may be applied with the heel of 1 hand. Keep your fingers off the victim's chest. Increase the compression depth to 1 to 1.5 inches and decrease the compression rate to 80 compressions per minute. CPR is most effective when started immediately after a cardiac arrest. Since there is usually a question of the exact duration of the cardiac arrest, the victim should be given the benefit of the doubt and resuscitation started at once. Special training is required to be able to recognize cardiac arrest and to perform CPR.
All right, the next thing we want to do is check for a pulse. And the way you do that is you take your 2 fingers like this, and you want to use the ball of your fingers, put it on the voice box, and slide it around this side. You want to hold that for 10 seconds to make sure that the person has a pulse or hasn't a pulse. What I'd like to do is everyone on their left try it on each other, and see if you can feel a pulse in here. Bill, put it on the voice box and slide it around. Okay, count it off, Bill, when you find it.
1, 2, 3, 4.
Okay, all right, everybody have it? So obvious this mannequin doesn't have a pulse. The next thing we have to do is cardiac compressions. Now the location of this is very important. Down here at the end of the sternum we have a bone connection like this. You can hear it on this one. And we want to locate that with our ring finger. Now what you can do is try it out on yourself. See if you can feel this little pointed bone right down here.
CPR should not be taught or practiced on human subjects, but some of its techniques, such as head tilt, checking the pulse, and determining the correct location for placing the hands, can possibly be practiced at home on friends and relatives.
We want to use the heel of your hand because we're going to bend it up this way, and you can get the most pressure on that sternum just by using this heel of your hand.
Actual practice should be on lifelike mannequins. Practice with mannequins is mandatory because of the possibility of injury resulting from chest compression. Initial practice and repractice at least yearly is necessary if performance is to be effective.
You want to go up and down like this.
Remember, you can learn to perform effective cardiopulmonary resuscitation after training. Don't delay. Learn to save a life now.
Just the heel of your hand. Put your other hand on top. All right, start. Try to keep your elbows as straight as possible, Bill, and try not to get too much body into it. You just want to get the weight of your shoulders and your arms as stiff as possible to give it a piston type action up and down on that sternum. We want to compress that heart from 1.5 inches down to 2 inches. And what this is actually doing is pumping. And we could actually feel a pulse on this mannequin while Bill's doing it. And he's doing it correctly. A little firmer, Bill. Try to keep your elbows straight. You want to avoid this jumping action because we might do some damage that way. You want to get it straight up and down if possible. Okay. Just try not to get so much body English in it. Just your shoulders.